Erectile dysfunction can be caused by 4 conditions. The first is psychological or emotional, and we're talking about depression, we're talking about stress, etc. The second is spiritual, when you have a spiritual husband or a spiritual wife, or you have an attack from the devil. The third is medical, and that's what we are going to be dealing and talking in depth on today. And the last is physical, weight gain, smoking, drinking alcohol, and what have you. Welcome back to my channel. I'm a seasoned medical microbiologist. Show me some love by smashing that subscribe button and sharing with a friend. What are we waiting for? Let's roll in. We're going to start by defining what erectile dysfunction is. Erectile dysfunction is the inability of a man to have and maintain erections. Now, some communities and in some parts of the world, they equate erectile dysfunction to impotency. That is, the man can have erections, he doesn't have any desire. In fact, he can't even ejaculate, he can't make a baby. So depending on the region or the community where you are, or the part of the world where you are, different definitions are given to impotency and erectile dysfunction. It is very important that as you are trying to fix or correct erectile dysfunction, you must be looking at the 4 conditions I have given you. The physical, try to correct the physical, try to correct the spiritual, try to correct the psychological or emotional, and the medical. Don't just focus on one of the causes I have given and trying to get out of it. Don't just focus on that. And also, under the medical part of erectile dysfunction or medical conditions, we also have people who are low on iron, low on some minerals that could cause erectile dysfunction. And this is why I did videos on homemade Viagras that can actually boost your erections. And when we are talking about erectile dysfunction, we are talking about no ejaculation, delayed ejaculation, premature ejaculation, and retrograde ejaculation. I did a video on the different types of ejaculation a man has, and I gave in summary how it affects the man, and you should watch. I also did a video on how a man can help himself get out of erectile dysfunction, and also how a wife can help her husband go out of erectile dysfunction. I also did natural ways in which you can boost erections. I have done several videos that can help men, get out of these issues and they can enjoy their marriage. They can have a blissful marriage and a healthy sexual life. So the first on our list is cardiovascular diseases. For example, we have high blood pressure. High blood pressure is very common. It's also known as hypertension. Now, all around the world, there are people who are taking drugs constantly to eradicate this problem. There are a lot of pharmaceutical drugs that are being produced daily to sort this problem. Unfortunately, the pharmaceutical drugs that you are taking are 99.9% responsible for you having erectile dysfunction or not being able to get out of erectile dysfunction. So it's very important to use Mother Nature, to use herbs, to use spices to correct this problem. I did homemade Viagras. I did an alkaline solution that will actually help you in a very short period of time. I did homemade Viagras for those who have high blood pressure, and it will help boost their erections. And there are many testimonials coming in. I also did a video on having sex with high blood pressure, with hypertension. And that video was very impactful and very informative. So it's very important that before you have sex, please do check your blood pressure, and after sex, you check your blood pressure. And I also did a video on the best time to have sex, and that's in the morning hours. As a couple, as someone with high blood pressure, you can overcome this without relying on pharmaceutical drugs 99.9%. You can get off drugs because you end up taking this for the rest of your life and living miserable and maybe having a broken marriage because your affection drops, low libido, you are frustrated as a man, it affects your self-esteem, it affects your ego, and a lot more. Another heart disease is low blood pressure. So far, while doing my research, I realized that there isn't a lot of information out there indicating that low blood pressure directly causes erectile dysfunction. So a lot of people who have low blood pressure, who have asked this question, how can I help them? I'm still doing a lot of research to be able to give you results, give you a conclusion that would really benefit you. It's not about just reading one or two articles. You have to do in-depth research to be able to make a video to have impact on people with low blood pressure. So if you're having low blood pressure, I haven't forgotten about you. I'm still thinking about that video. I'm still collecting data, metadata, info to be able to do a really insightful and informative video to help you overcome your challenge. And the next is diabetes. That is an increase in blood sugar or glucose in the blood. In fact, diabetes is more dangerous than high blood pressure. You know, I'm telling you, it has the ability to destroy nerves and blood vessels, to block them and to actually harden them, thus preventing blood from flowing towards the genitals and to different parts of the body. So it can cause a part of your body to get numb and not function at all. And it's very dangerous. I did a video on having sex with diabetes. You should watch that video in detail. And I also did homemade Viagra's for those who have high blood pressure and for those who have diabetes. And you're going to be okay. People who have diabetes, most times, 99.9% times, have high blood pressure. So with this, instead of leaning so much on pharmaceutical drugs for 365 days a year, all the days of your life, can you look at Mother Nature? Can you look at the homemade Viagra's? Can you look at the herbal drinks, the tinctures you can take to boost your immune system, to get off it? And one of the things you should be looking at is the homemade alkaline recipe I did on this channel. It's going to help you correct a lot of things. Why not get into exercising? I did a video also on how to boost your erections naturally. You know, no cost, no drugs. Because every pharmaceutical drug you take has a side effects in a long run. And you may end up shortening the days of your life on earth. The third disease is kidney disease or chronic kidney disease. Kidney diseases are very, very rampant as well. And the kidney is responsible for filtering out impurities or toxins from our body. So when your kidney is not able to filter out these toxins, it begins to affect blood flow, the natural functioning of other organs, and it can shut down erection. It can really, really affect erection as a man. The fourth is Peyronie's disease. I did a video on this, Peyronie's disease. Peyronie's disease is when there is a scarring or there's a build-up of tissue in the tissues of the penis, in the skin of the penis, and it causes the penis to curve or to bend. In some people, it may cause pain. In some people, they aren't able to even get an erection, please go to the doctors if you are having this issue. If you notice that your penis is curved or is curving, or while you're having an erection is curving towards a particular direction and is causing pain or inflammation. The next disease is blood vessel damage, arteriosclerosis. And this is also very common. When there's a damage in the blood vessels, it will affect a lot of blood flow towards your genitals, and you will be experiencing erectile dysfunction. The sixth point is nerve and brain damage diseases or conditions. We are talking about stroke, autism, Parkinson's, Alzheimer's, and a lot more. Anyone you see with any nervous breakdown condition or disease is struggling with erectile dysfunction, whether they were born with it or they developed it as they were growing. And the last point on our list is hormonal imbalance. Now, sexual stimulation, desire, erections, orgasms are all orchestrated or all initiated through hormones, stimulation of hormones. And during a sexual activities, you have over 10 hormones that are actively working to make sure that you have pleasant orgasms and you enjoy after. You feel good after. In fact, the whole process is one hormone after another. So if you have hormonal imbalance, for example, if you have hyperprolactinemia, or if you have a tumor on your pituitary, or if you have a damage on your pituitary, imagine how confused the hormones in your body are going to be. Let's say you have an increase in your body starts producing excess estrogen or excess testosterone or low levels of cortisol, low levels of sex hormones, or even deep prolactin, high levels of prolactin, low levels of prolactin. It will mess up your sexual function as an individual. And this is why whenever you see a male who has breasts, who starts developing breasts, or who looks like he has breast, or he starts developing mammary glands, please take him to the hospital and let his hormones be checked. 99% of the time, men who develop breasts or have breasts have hormonal imbalance. They are not able to perform. They have poor sexual function. Now, I'm going to give you 2 bonuses of medical activities that could cause a man to have erectile dysfunction. The first is taking medical drugs. Some medical drugs can actually initiate erectile dysfunction. So it's very important that when you are in front of your doctor, explain to them the drugs you are taking, the herbs, the tinctures, whatever. Be open. As a medical professional, I have noticed that most patients don't give the full information when they're in front of the doctor. Most times they keep some information and think it's a personal thing. And they don't understand that your whole body is linked together. The second bonus activity, medical activity, I'm going to give you surgery. If you're having surgery, let me say that affects your prostate, let me say bladder surgery, prostate surgery, just know that you have a tendency of experiencing erectile dysfunction. Let me say a few months after the surgery, or if it's not properly done, if it touches a nerve, if a nerve has been damaged, you may just be having erectile dysfunction for a longer period of time until it's corrected. So, thank you for joining me into this class. I remain your seasoned medical professional, Gwendolyn Halle.